Hello and welcome to this week's edition of Health Talk. I'm Peter Ndoro. Thanks for joining us. Now, Health Talk is focusing today on World Autism Awareness Day, which is marked on the 2nd of April. The world commemorates the day and the month that follows in honor of those children and adults who live with autism. According to the US Centers for Disease Control and Prevention, 1 in 54 children are affected by autism, with the condition 4 times more common in boys than it is in girls. Well, coming up on the program, producer Wandile Mofokeng spoke to a mother of 3 sons, 2 diagnosed with autism, and author of Saving My Sons, A Journey with Autism. She shares her story and advice with us. We also speak to another parent living with an autistic child about his experiences and coping methods. And we then speak to a child psychiatrist to help us understand everything you need to know about autism. So a little bit later on as well, we'll be speaking to an occupational therapist about treatment and therapy for individuals living with autism. And then finally, of course, we get advice from our regular GP about some of the issues that you're facing in terms of symptoms, post-COVID symptoms of COVID-19. Okay, so let's begin the show where we always do, and we look forward to these statistics because sometimes it's good news. Let's find out from Zama Buthelezi, our senior producer, what the story is in terms of COVID-19 in South Africa. Zama, top of the morning to you. Are you all right?
Top of the morning to you too, Peter.
So what is the situation? Where are we? Is it or is it
It's
Aye.
A very good morning to you, Peter, and our Health Talk viewers. While active cases remain stable over the last week, experts fear gatherings and traveling using public transport over the long weekend might lead to an increase in infections over the next weeks or two. Globally, more than 137 million positive cases have been reported. More than 78 million people have recovered, but sadly, more than 2.9 million people succumbed to COVID-19 related illnesses. India overtook Brazil this week, recording more than 168,000 new cases as the country allowed social, religious, and political gatherings, and citizens became complacent. South Africa is still leading with the infections in the continent. Just an update on the vaccine front, Health Minister Dr. Zweli Mkhize announced the temporary pause of the COVID-19 Johnson & Johnson vaccine rollout. This follows a recommendation from the Centers for Disease Control and Prevention and the United States Food and Drug Administration, where 6 women reported a rare type of blood clot 6 to 13 days after the Johnson & Johnson vaccine was administered. South Africa voluntarily suspended the rollout until the causal relationship between the blood clot and the vaccine is sufficiently interrogated before additional supplies of the vaccines arrive on South African shores next week. The next step will see SAPRA collating all the information in order to make a thorough recommendation, and hopes are high to resume the vaccine rollout soon. But for now, let's take a look at the national COVID-19 statistics. To date, more than 10.2 million tests have been processed in South Africa. More than 1.5 million people tested positive. More than 1.4 million people have recovered, bringing the recovery rate to 95%. But sadly, more than 53,000 people have died from COVID-19 related illnesses, and we are sending our heartfelt condolences to their families. While we are seeing a 95% recovery rate, 4 provinces with big metros continue to record the highest numbers of COVID-19 infections a year later, as well as new infections and deaths. Let's take a look at the infection numbers recorded in the big provinces to date. Gauteng is still leading with more than 418,000 positive cases to date, followed by KwaZulu-Natal with more than 335,000 positive cases. At number 3 is the Western Cape with more than 284,000 positive cases, and at number 4 is the Eastern Cape with more than 195,000 positive cases. The following provinces were recording the lowest numbers, but these increased sharply at the end of 2020 during the festive season. Experts say the next week will be important in determining if there will be a spike in transmission caused by people who traveled during the Easter holidays. The concern last week was that super spreader events allowed over Easter may trigger a new tide of new infections. But for now, let's take a look at the total infection numbers recorded by these provinces a year later. To date, more than 85,000 positive cases have been recorded in the Free State. More than 76,000 positive cases have been recorded in Mpumalanga. More than 65,000 positive cases have been recorded in the Northwest. More than 63,000 positive cases have been recorded in Limpopo. More than 37,000 positive cases have been recorded in the Northern Cape. Despite COVID-19 data showing a relatively stable rate of infection a week after the Easter break, it's still too early to tell whether lockdown measures over the long weekend were effective or not. Some experts have warned that the third wave of COVID-19 infections is looming in South Africa, and human behavior is what will determine whether South Africa gets the next waves. This will also determine their severity. We are still urged to continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitize using sanitizers containing 70% alcohol content. We must all continue to wear a cloth mask that covers both our nose and mouth in public. We must continue to practice social distancing and ensure proper ventilation indoors. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. The number is 0800 029 999 and alert them to your symptoms. As usual, protect yourself to protect others. Thank you so much, and back to you, Peter.
All right, yeah, I suppose the big story this week is this pause button on the Johnson & Johnson vaccine, isn't it?
Especially because we were behind anyway as a country with inoculating the citizens. So precautionary measures, we need to up our game.
Yeah, you're so right. Thanks so much indeed, Zama. Thank you. All right, so those are the statistics, but remember that as we observe and report on these numbers, these cases can and often jump quite a bit, so just bear that in mind. And please, the mask thing is very, very important. Cover your nose, don't just cover your mouth. It's not a chin guard. You've got to cover your nose, everything. Okay, you can also be part of the show by asking our guests some of the questions on your mind, and you might even be able just to share some of your thoughts about the issues that we're discussing today. And of course, today we're focusing on the autism spectrum. And the number to call is 011, that's Johannesburg, 714 5861 or 5877. That number again, Johannesburg 011 714 5861 or 5877. You can also get us on social media, and we are on Twitter. Our hashtag or our Twitter handle is @SABC Health Talk, @SABC Health Talk. And you can also find us on Facebook with the same name, SABC Health Talk. So the program continues right after this. Stay with us. Welcome back. You're still watching Health Talk. Now, the early detection of the red flags to autism is essential to making the diagnosis in a young developing child, as early intervention often sets the stage for better outcomes. Author and mother of 3 boys, 2 diagnosed with autism, Ilana Gelshowitz sends a powerful message through her book, Saving My Sons. And that's a journey with autism. She sat down with producer Wandile Mofokeng to talk about her journey with autism and also share some knowledge from her book. Let's listen.
Ilana, thank you so much for your time and welcome to Health Talk on SABC News.
Thank you so much for having me today.
Could you just kindly talk to us about your journey with your son that is living with autism? Or rather, firstly, talk to us about your son. What type of person was he before finding out that he is autistic?
I have an 18-year-old son. His name is David. And when he was 18 months, he suddenly stopped developing. And we noticed that he lost the skills that he could do before. For example, he used to play peekaboo with us. He used to babble, like mama, papa, dada. He was playing with his toys nicely. And then one day, all of a sudden, he started to line up all his toys. He started to flap his hands, started to walk on his toes. And if we call his name, he wasn't responding. So we started to investigate what's going on. We had a typically developing child, brought home a typically physically looking 100% perfect baby. And now all of a sudden, it was as if we couldn't reach him. The doctor who gave us the diagnosis didn't indicate that there was really much that we could do about it. They said, your son has autism, goodbye, and good luck.
How easy or difficult was it for you as a family to adjust to his condition?
It was very scary in the beginning because I didn't know how we were going to teach him. And I knew he couldn't just fit into the mainstream school, but there were really not many special needs schools around that I thought that could help him.
What were some of the severe symptoms or things that you could recognize about your son that needed more attention? Can you just kindly talk to us about those specific symptoms?
He was 2 years old and he was getting older. He was getting to be 3 years old and he wasn't speaking. Can you imagine a child who can't speak, who can't say, Mommy, I want water, where they want to go, what they're feeling? It's unimaginable to try to imagine a child who can't speak. Have you ever heard of something like that? So I think my one big focus was to get him a means to communicate, because if you don't have a means to communicate, you're going to communicate through crying, tantruming, biting, kicking, screaming, and my son was doing those things.
Do you see any development or changes with regards to his speech with those interventions that you were mentioning?
Once we started this ABA intervention, he started to learn to speak words, and it was so empowering for him and such a blessing for us as a family, because now he could call my name and he could tell me what he wanted, because before, if he wanted something, he would just cry. Having said that, with my son, because he was more severely autistic, we gave him an iPad and it had a special communication program on it. He still uses it even today when he's 18. Now, some things he can say words, other things he uses this program and he types sentences. And it's a very good way to help those children who are struggling to speak vocally.
Speaking of teaching, talk to us about the book that you wrote with regards to your son. What prompted you to write the book and what's the book about?
I wrote the book because I wanted to give other parents a roadmap and a way forward. They are now where I was 17 years ago, starting this journey. So I wanted to give them the information they need to understand the diagnosis and to, most importantly, understand that this thing doesn't mean your child has no future. It is treatable.
Ilana, thank you so much for your time and that insight and knowledge. And best of luck with your school and your kids.
Thank you so much. I appreciate that you had me as a guest on your show. Thank you.
Thank you.
All right, and if you can get hold of that book, it's a powerful, powerful book. I remember talking to her. She has two sons, and one of them actually is autism symptom-free now. The other one, obviously, still managing those symptoms. And treatment really is there, and you can get help. But let's continue to hear more testimony from another parent living with an autistic child or child living with autism. And we're joined on the line by Sylvester January. Thanks so much indeed, Sylvester, for joining us. Welcome to the program.
Hi, welcome, Peter.
All right, so I see, is that your little boy?
Yeah, it's my little boy,
Ah, brilliant. Good to see him. When did you first realize that he's different?
I've been with him for, it's my adopted child.
Right.
It's 4 years ago when we took over taking care of him after the mother passed on. And then through the visits to the local hospital, it's where he was actually diagnosed with autism. So when we picked it up.
So was it easy to get the diagnosis, or is it one of those challenges where it takes quite a bit of time and effort?
No, through the visits, the regular visits as a toddler with his clinic card, you know, it's where we got hold of a doctor who came across that he might be having this through all the tests they ran also. And then he can hear, but he can't speak.
Right.
So he went through some other checkups, and then all those things came to the conclusion that he needs to get under treatment of this condition, yeah.
All right, so you must have had to go on a pretty quick learning curve in terms of how to manage a child living with autism. What are some of the challenges that parents typically face?
Oh, yes, I had to go through a lot of changes in my life because it wasn't anticipated that I would come across a child who's like that. I've got 2 children of my own who are very normal, not having this kind of a condition. So we had to readjust everything between me and my wife. And then it's through Parental for now. We actually sought for information, guidance, and all those things. So it was totally an uphill battle, as it is currently going on now.
What about things like school? Do these become a challenge in terms of placing and getting him through an education?
Yes, we did engage him in a mainstream kind of a kindergarten some 2 years ago. As a child, as small as he is, he was about 3 years when we took care of him. And then what happened is he would just wander away from the other kids, you know. He wasn't really used to being in crowds of kids. So he had to start this new thing, going for the first time to where his heroes will be all there. And then, you know, it was quite hectic for those people because those teachers were not trained for this kind of a child. So I had to look for some other school around here in Mafeking. Unfortunately, we couldn't find an exclusively school which could cater for autism. So there is a special kind of a school going on here where I've engaged in so far. So they trying, but on the related condition of Parental, really, we don't get such the side. It's outside town only where I could get some a related school which will cater for it.
What's your best advice for parents that find out that their child is living with autism?
The best is to, you know, the first thing is love. The first thing is to show him a lot of love.
Yeah.
If there are other group of other children within the family household, you must never feel that he's alone. Okay? You care as much as you care for those who are in a normal. So it's actually very important that he must feel loved and then cared for and engaged. The normal kids must engage with him in all those normal kind of things which they really do, like taking a book, a coloring pencil and all those things, an apple and a banana and all those things. You know, those domestic trainings which will come in handy. It will go somewhere. It will go somewhere with this training and then coming back and then, you know, ultimately talking. So what he does right now is Papa, Mama, And then, and the sister's name is got a sister, Katlego. I heard him now the other day screaming Katlego, and I was quite impressed that he's coming around.
Yeah. Sylvester, thank you so much for sharing your story with us and introducing us to this lovely young man. Thank you so much.
No, you're welcome, Peter. Thank you.
Take care. All right, that's Sylvester January, who's a parent with a child living with autism. After the break, we speak to Dr. Helen Clark, who's a child psychiatrist, about autism, so stay with us. Welcome back. You're still watching Health Talk. And today we're focusing on autism, and it's known as a spectrum disorder because there's quite a wide variation in the type and the severity of symptoms that people experience. Autism spectrum disorder, or ASD, occurs in all ethnic, racial and economic groups. Although ASD can be a lifelong disorder, treatments and services can improve a person's symptoms and ability to function. Well, to help us understand a little bit more about autism broadly, we're joined by child psychiatrist from the Chris Hani Baragwanath Hospital, Dr. Helen Clark. Dr. Clark, thanks so much indeed for joining us. Welcome to the program.
Thank you.
All right, so I suppose there is a reason why they call it a spectrum disorder, because it's quite wide-ranging where autism falls, the symptoms, what you can experience. Tell us a little bit about, broadly, what is autism?
Autism is a neurodevelopmental disorder. It's a brain-based disorder which starts in early childhood and develops as the child grows. It is a spectrum disorder which has a wide range of symptoms. So children can have a large number of symptoms, or they can have some of the symptoms, not other symptoms. So what we see with the children that we see is that each child is actually fundamentally different. They're individuals, they have different needs. And so, as you said, it's an extremely diverse disorder. And yeah, children have different needs.
Do we know what causes it?
It is fundamentally a genetic disorder. Sometimes it's very difficult to track back genetically. Quite often there are family members who had disabilities of speech. But we also know that in previous times, diagnoses were not made. That is actually possible sometimes. Well, often a parent will say, well, I had some of those features when I was growing up. There are factors in the environment that can contribute, particularly to the manifestations of a genetic predisposition. But there are many myths about environmental causes. Like, for example, for many years, there was the perception that particularly measles vaccination contributed to the development of autism, which has now been shown to be absolutely incorrect.
All right, so you said it's something that develops in childhood. Is it different in terms of onset? Could some get them late childhood, some as babies? What do we know about when one starts to see symptoms and develop symptoms?
It really depends on the severity. So, and which symptoms are going to present. The symptoms that we reckon that where children are presenting early on in the condition are those children who have specific speech difficulties. So where children present with delays of speech, usually it's identified by the age of 3. Where children have deficits more in social communication, it may become evident later. But the more symptoms of autism that the child actually presents with, the more likely it is that the autism is going to present earlier.
All right. So as a doctor, what are the things that you look out for, particularly in toddlers and maybe even babies?
Autism is a disorder of social communication. So what one is looking for is disorders in how the baby interacts. You can get symptoms, you can get, in the worst possible state, a situation where the child does not make eye contact, where the child does not interact with other people, with other children, with even moms sometimes, moving as the child gets older to seeing that the child doesn't interact with other children. So you get a history from the creche that the child is not interacting with other children. You notice that the child sits in a corner and prefers to play by themselves, or they play next to other children. We call that parallel play. As the child gets older, and we see that they don't interact at a reciprocal level. They don't engage in conversation and that kind of thing. They also just don't interact as we would normally interact. They don't use gestures.
Right.
They don't form relationships. So they don't make friends. They don't have friends. They don't talk about other children when they come home from school. But the essence of social communication is speech. And this is often the reason why our children present. And they present when the parent gets the idea, my child's not talking.
Yeah.
By the age of 3, the child is not starting to develop the complexities of speech, which is making sentences, starting to converse, which is a social functioning as well as the development of language.
All right.
Language is...
We're running out of time. We're running out of time, so I'm going to rush us a little bit. And I just want us to maybe talk a little bit about treatments. There's no cure. Is that something we can accept?
That is correct. That is correct.
All right. So how does one start to treat these symptoms? And I guess it depends on the severity.
It depends on the severity and it depends on the resources available. I think one of the most important things in this country is the available of adequate schooling. And it's one of the important developments that we have is the availability of state autistic schools and autistic classes where speech and occupational therapy are available in our government school systems. Schools with speech therapy, occupational therapy, and trained teachers to handle these children. They cannot be educated in mainstream schools because mainstream schools teach through language.
Right.
And they cannot learn through language. They learn in a completely different way and need to be handled in a completely different way. And speech and occupational therapy are crucial for these children. there are many other ways in which some children are managed that are more mythical than they are really effective. But I would say the crucial aspect which our Department of Education has instituted is the development and staffing of these schools. What we crucially need is more facilities and more staff who are specifically trained to work with these children.
All right, and because of there's a spectrum, there can be high-functioning people
Yes.
with autism, incredibly intelligent, but have this behavioural and communication aspect.
I think it's very important to realize that in the newest diagnostic phase of autism, what has been included in the autistic spectrum is what was previously separate, and that is what was previously called Asperger's. And Asperger's, now part of autism, was a condition where the child develops speech, and the fundamental deficit was a deficit of social communication. So they struggle to connect. They struggle to work in groups because they don't have social skills. They struggle to make friends, often very lonely kids. But they can range in IQ to being very, very high functioning. And they can live very much more normal lives. They can attend mainstream schools, and because they have language, tend to be quite struggle with abstract language. They are often seen as different.
Yeah.
But it's very important to realize that whilst the majority of autistic children are actually in the low functioning range, the true autistic children can be high functioning. And then there are these children who used to be called Asperger's, who can in fact be very high functioning.
All right, Dr. Clark, thank you so much for joining us. I wish we could talk for longer, but time's not on our side. Thanks so much indeed for your insights on the program today.
Thank you.
Thank you. All right, that's Dr. Helen Clark from the Chris Hani Baragwanath Hospital. After the break, we speak to Jackie Patterson, who's an occupational therapist, about the importance of treatment and therapy for people living with autism. Stay with us. Welcome back. Let's continue with our discussion here on Health Talk on autism. Now, treatment for autism should begin as soon as possible after diagnosis. Early treatment for the autism spectrum disorder is important, as proper care can reduce individual difficulties whilst helping them learn new skills and make the most of their strengths. To talk to us a little bit about treatment and therapy available for people living with ASD, we're now joined by occupational therapist Jackie Patterson. Jackie, thanks very much indeed for joining us. Welcome to the program.
Thank you.
So just before the break, we were talking to a child psychiatrist, and she kept on saying occupational therapy is a really important part of treating children with ASD. Take us through why OT is a critical part of that process.
So part of the diagnosis of autism is that people struggle with the rigid and repetitive behaviors. And under this falls your sensory processing difficulties. And that's where, as OTs, we start. In fact, that's where, as people, we start, because we process the world through our senses. Many people on the spectrum, in fact, most of them, struggle with sensory processing difficulties. If you think of a young child, one of the early things that they have to learn to do is to be able to regulate themselves so that they can interact in all parts of life. And many people with autism struggle with this, so they can't regulate themselves. They either under or overreact to sensory stimuli. So a vacuum cleaner will have a child blocking the ears, or hiding under the table, or running away screaming. A light touch might get, so a child bumping into another child might cause the child to react by biting or hitting because that feels painful to them. In fact, certain sounds may be perceived as painful because they're not processing that information appropriately. So that's the one part. And most of our skills are built on our processing of sensory information.
All right.
The other part that we're working on a lot, and that's come to the fore with what's coming out of a lot of our autistic adults, is that motor planning or apraxia is a significant problem within autism. So planning their movement. So their muscles are fine and their brains are fine, but actually organizing and sequencing the actions so that they can do what they're thinking about is a huge problem. And this affects not only what they do, but the ability to say what they're thinking.
All right, so we're going to talk a little bit more about those issues because we've got a caller on the line. I believe we have Wusi. Wusi, thanks so much indeed for joining us. What would you like to share or perhaps ask?
Thank you for accepting me. I've got a 4-year-old. He's autistic and he was diagnosed last year. The most problem that I come across with him is that when we're in the malls, I can't take him to the bathroom because of this thing that we use to dry our hands. He's afraid of that. And I can't be with him where there are a lot of people, like in parties. He doesn't like to be where a lot of people. So those are the challenges that I'm coming across with. But he's currently attending occupational therapy and the speech therapy, and he's taking medication. He's on Risperdal and Epilium.
All right, okay. Let's hear from Jackie. What other support you could get for a child with those typical symptoms? Thanks so much, Wusi, for sharing your story. I guess you hear this all the time.
Yeah, so it's one of our roles is to support parents at home, and our parents really struggle going to malls. So what I usually suggest is we need to grade it up. So you start with a small shop on a Sunday morning when it's quiet and you introduce your child to it. As part of our school program, we actually take our children to the shops to introduce them in a visual and a strategic way so they get used to going to the shops because it's a normal part of life, and we want people with autism to be part of our communities. So what you can do is give a child, first of all, go at a quiet time. So don't go on a Saturday morning at 11 o'clock. It's too much. It's too much for most people, and it will definitely be too much for your child. So go at a quiet time. If you can, put headphones on or earmuffs or a hoodie, and that helps to block out some of the sound. Put him in a trolley if you can, because that will help to contain him. And then something crunchy generally helps us to calm down. So deep pressure helps most of our kids to calm. So having something crunchy like the corn nibs or chewing on mango strips or a piece of biltong does help to regulate, because that's one of the regulation strategies we use.
So one of the symptoms that we keep hearing about is repetitive behaviors and routines. Is this part of the therapy where you introduce new routines that can help them?
Yes, so most people with autism have a great visual strep. So they cope better when they're shown things visually. So we always pair auditory with visual. So one of the things that we do within routine is that we introduce visual schedules which show the child what's happening or the person what's happening next. And obviously this is graded depending on the level. So our 3-year-old will have photographs, but an 18-year-old will have a diary.
All right, okay. Looks like we might have lost Jackie on the line there, but we'll try and dial her up again. So as you can hear, a number of issues that you will probably have to face because the autism spectrum disorder is so wide. And you've heard from Dr. Helen Clark that Asperger's is now something that's been brought into that spectrum. And that's typically what we've heard and seen is socially they say things perhaps without filtering as some of the symptoms associated with that. But high-functioning people, so one has to be careful how you treat each person because they're all individuals and they're dealing with different issues. All right, I think we've got a caller on the line. Is that Nombokolo?
Yes, sir. Good morning.
Good morning to you. Thanks so much for joining us. And what would you like to share?
I also have an autistic child. He is now 8 years old, and he actually loves to touch people. And, you know, sometimes it's actually a problem for people who do not understand autism. And when the medication is actually over or done in his body, he will start jumping. But he loves people because he's not afraid of people.
Right.
And, you know, it's actually also a problem where I stay because sometimes it's so hard to actually get a school for him. So that is basically my main concern. And he's now 8 years old, and we only discovered that he's actually autistic when he was 5 years old. So, he's now living with this condition.
All right.
Yes.
Ntombaklolo, thanks so much indeed for joining us and sharing your story with us. Jackie,
Thank you, sir.
Thanks so much for coming back. We lost you there for a few moments. We're running out of time, unfortunately, so perhaps a broad question is more about advice. You know, parents sometimes feel overwhelmed. They've got a child, and depending on where on the spectrum they are, what's your advice to parents? How should they get help?
So certainly in Gauteng, we've got a lot of government schools that now support children on the spectrum. So they have to go to their local district offices to put their child on the waiting list for an autism-specific school. If they can get support from from an occupational therapist, it is useful, especially a therapist who has training in sensory integration. But then also understanding what their child's triggers are. So like your previous caller who's mentioned that her child can't cope with going to the mall, then maybe that's something that she needs to understand as a trigger for him and try to work through it so that it doesn't become very challenging to him. So it's understanding those triggers.
Yeah.
Some children overreact, some children underreact. So you may have children who love jumping, who love crashing, who love hugs. Then give them the hugs and find them, get them those sensations that they're seeking in an appropriate way. So get a trampoline if they love jumping, take them to the park. If they love hugs, give them hugs, teach them who they can hug, find tight clothing that will give them that squashed feeling, get them a weighted blanket or put something heavy on their lap. They need to just try and understand the sensory triggers of their child.
Jackie, I think we're going to have you on again soon, but thanks so much indeed for joining us today.
Thank you.
Great. That's occupational therapist Jackie Patterson. Understand your child and give them what they need. We're going to take a quick break, and when we come back, COVID-19 and our GP answering your questions. Stay with us. Right, welcome back. This is the last section of the show, and here we take your questions on social media and get you proper answers from a qualified person. Dr. Marlon McKay is our regular GP who gives us valuable advice. So let's say good morning to him. Good morning, Dr. Marlon. Welcome once again.
Thank you for having me again.
All right, okay, let's go straight into the questions. Noctula says, hi, I'm very sick. It's day 3 today. I went to the doctor on day 1, but my symptoms only get worse every day. Can anyone advise what I can use for my blocked nose? Until now, my nose has become very painful. I suppose day 3 is still early, isn't it?
Oh, it's still early days, and especially with this, with the last wave that we had, patients tend to deteriorate. They look like they were getting a lot better, and then by day 10, even day 11, when they should have been de-isolated, they take a bad turn. So day 3 is still early days. It's probably going to be a rough ride, and the following things are what I suggest. Number 1, spend some time in the sun when the sun is out. Lay as much as you can on your tummy, not on your back. Number 3, make sure that you are steaming regularly during the day. So boiling water and anything like menthol eucalyptus, some sort of menthol substance in there, a few drops, steam and then blow your nose. And then you can also get some of the nasal sprays may also help. It's going to be rough, and use something for pain and for headaches, and just take it easy. Don't panic, and monitor your oxygen levels as well.
All right, okay. Leonie says, anybody in this group that is still dependent on oxygen 2 months after being discharged from hospital? Is that possible?
Yes, that is. We see that quite often. Not so sort of 2 months, but usually a month, 6 weeks. But depending on how severe the initial infection was, whether you're in ICU, intubated, what sort of oxygen, whether high flow nasal oxygen, so we'll determine. And of course, the CT scan damage to the lungs, the amount of fibrosis. So we see patients 3, 4, 5, 6 months, Peter, even after the initial COVID infection. So 2 months, hopefully you are improving a little bit every day, and we can start weaning you off the supplemental oxygen.
All right. Ziku says, I tested positive in January and now I'm suffering from headaches. I've done x-rays, MRIs, but they can't see anything. My neck muscles are weak. I get dizzy. And I suppose looking for help in Gauteng and Pretoria especially. Is that something that you see? I mean, tested positive in January. We're in month 4 now.
Yeah, so this would fall under the condition called long COVID or post-acute sequelae of COVID, PASC, that we see where you have persistence of symptoms ongoing even after the initial infection, and the presentation is so diverse. You get this brain fog, and in this case where you can get the headaches and the fatigue and myalgia. It's almost like a yuppie flu type picture, myalgic encephalitis we used to call it. Very common with post-COVID conditions, and causes excessive fatigue. And the treatment is very difficult because we just don't know, Peter. And it is symptomatic mostly. We give something for muscle aches, to relax the muscles, strengthen the muscles, physiotherapy, seeing a biokineticist, something for headaches, and then just reassurance, that it's not in your mind, it is real. And it does get better. It just takes time. So please be patient and seek appropriate help.
Dr. Marlon McKay, is short and sweet. We'll join you again next week. Thank you so much indeed for your advice and your time.
Thank you, Peter. Bye-bye.
All right, and that's where we come to the end of this week's edition of Health Talk. Thanks very much indeed for joining us. And don't forget, COVID-19 is still with us. It's still real. So please do all the protocols. Wash your hands, sanitize them, sanitize your surfaces, social distance, stay at home as much as you can. But really, most importantly, wear a mask. Bye-bye.